Hello, this is Dr. Scott Mosser, gender surgeon from the Gender Confirmation Center in San Francisco, and I want to talk a little bit about dog ears. So dog ears are a hot topic in the world of FTM top surgery, and yet I don't think I've ever seen a good example and explanation as to why, geometrically speaking, dog ears can occur, and what can be done to try and keep them from happening or treat them if they do occur. So first of all, what is a dog ear? A dog ear in this sense is a protrusion of skin which can occur at the outermost portion of the incisions wherever an ellipse of tissue is removed from the body. Most people don't think of the mastectomy as a removal of an ellipse of tissue, but geometrically speaking, that's exactly what's occurring. To illustrate this further, let's take a quick moment to remember something we probably all did in our youth. Back when we were kids, most of us took a piece of circular construction paper, which was perfectly flat, and we cut a wedge out of that paper, and then when we closed it with tape, voila, we had a cone. The height of the cone was directly relative to the size or width of the wedge that was removed. Smaller wedge, lower cone. Larger wedge, higher cone. So how this relates to dog ears is that for patients, for the FTM double incision top surgery and some of the other procedures as well, the end of the ellipse is a bit like this wedge out of the construction paper. For patients that have less skin to be removed, that ellipse is going to be narrower. And for larger breasts and more skin tissue to be removed, that ellipse is going to be wider, and therefore the skin is going to protrude more. Think of the protrusion as that cone with the construction paper. More tissue removed, more protrusion. In addition to this cone concept, sometimes there's simply a fold of skin that continues onward and outward from the breast and all the way sometimes onto the back area. Not all of this skin can be removed in this first surgery, and in those patients, a dog ear is sometimes almost a certainty. One of the ways that we can make a dog ear less likely to occur is to extend the incision a little bit back, and therefore the incision extends into an area where the ellipse, and therefore that wedge, does not need to be as wide. If patients are willing to have incisions that are a bit longer, then dog ears can mostly be avoided. If a dog ear does occur, then strangely, the solution is to design yet another ellipse in a secondary procedure called a revision that's centered on the dog ear itself, and then to remove this cone of protruding tissue completely. Then the skin edges can be sewn together, and usually the contour at that point is pretty near perfect. So commonly dog ear revisions can be performed under local anesthesia if they're small. If they're longer than about 5 inches or so, then having some sedation or general anesthesia is a good idea because of the amount of local anesthetic that would be necessary to get you numb in a larger area. I hope this clarifies some things. Overall, dog ears are not completely avoidable, but usually can be considerably minimized with the initial surgery, and certainly they can be treated very effectively if they occur. For more information on this or any other aspect of transgender chest and body surgery, please click on the link and visit us, or certainly reach out to us for a consultation and we can speak about things in greater depth.